Hello, you're on the air. Do you have a question?
Yeah, I'm a COVID survivor. My wife and I both contacted COVID at the same time. And she is still having problems from it. She's on oxygen 24 hours a day, 7 days a week.
Wow.
Because
How long ago did you have
attacks to the heart, and that's been a year ago.
A year ago. That's a good segue into what I was just about to mention. I'm going to give you some, and I'll read to you some national statistics that just came out again from the CDC, and have been confirmed in Israeli studies. Survivors, as you and your wife are more than twice as likely to die from in the subsequent 12 months after a COVID infection than those who tested negative for the virus. So if you tested negative, you're half as likely to die if you've tested than if you tested negative. If you're over 65, that number
it also took 100 pounds off of me.
Yeah, absolutely, and you're blessed for being healthy enough to survive it. If you're over 65, that increases to almost 4 times a greater chance of dying. And that's not dying of COVID. That's dying of heart attacks, of perceived strokes. These are deaths that are not being counted as secondary to COVID. But the stress on our other systems is so great that other natural deaths are occurring into a person who was so stressed by the disease that the chances of you dying are substantially higher. Another argument to be vaccinated. Were you guys vaccinated before your infection?
No, I was vaccinated after the infection.
What was the cause of your delay?
We got it in January last year, a year ago this month.
May I ask what your hesitancy was in getting the vaccination?
I'm not sure really what the hesitancy was. I was reeling off some other sicknesses that I'd had over time, you know, and a doctor told me just kind of be careful, and so I just took the J&J. I took one J&J shot, and I took it in February after I had COVID in January.
Have you been boosted?
Have you had a booster?
I have not. I had my another shot that the doctor told me to wait 30 days or 40 days before I had the booster. I had the shingles. My last of the shingle shot. He said wait about 30 or 40 days until I got the booster.
How about your wife? Has she had any of the vaccinations?
And I would say they're going to probably recommend.
Yeah, she's had
or the Moderna
two shots and the booster.
But she's on oxygen
damaged her lungs. It damaged her lungs and caused her. It was putting a taxation on her heart. She couldn't walk across the room without giving out a breath.
That's an important point. So, you know, and thanks for bringing that up to us. It's everybody should learn from his experience. It's not an isolated experience. It's very common. And I'm sure it's filling the offices as outpatients with our wonderful pulmonology team at Nash, managing these enhanced conditions in people who once had COVID, who still test negative, but may never be normal again. Mm-hmm. You know, God forbid, but your wife may be on oxygen forever if the disease that hurt her lungs did not recover.
One of the things that we noticed with some of these ancestral strains like Delta, when they had the onset of symptoms, and let's say that was day 1 with the actual infection, that around the 8th or 9th day, they would either start to get better or it would go lower respiratory. And that became very serious with patients that when they went lower respiratory and noticed they were really having a difficult time breathing and wheezing when they did breathe, it was a really, really difficult time. We've seen a lot of long-term effects that are coming from these, especially those that ended up in the hospital and had lower respiratory issues. Now, he mentioned he lost 100 pounds, which is a good thing, maybe, depending on what he weighed before. But obesity has played a big high-risk factor with the Delta, well, with any of these coronavirus.
Anything that compromises your immune system, which includes age, we always talk about being over 60 or 65 as being a risk factor, diabetes, hypertension, and then access to health care. A big racial disparity in our community is that people of color have some institutionalized racism which prevents them from getting access to health care. It's not necessarily that black people are more sensitive to the disease or have a more compromised immune system, all else things being equal, but if a pharmacy is farther from you than it is from me, if your doctor's office and the availability of a clinic is farther away for you than it is for me, because of the wealth of your community, then that's where your health department really has to step up, and the hospital does as well by doing outreach programs.
And they have.
And they have.
Yeah, I can't wait to mention that.
Yeah.
We joined forces with Reverend Thomas Walker and his son, Councilman T.J. Walker. And we did a number of clinics. He just worked very well with Ebenezer Church. I can't say
And
enough
Word
good things
Tabernacle and
about the
Greater
Walkers.
Joy. And in fact, our hospital had people go, and I think it was the health department, to people's houses even.
Yeah.
I mean, that's probably one of the only good things that's come out of this pandemic, is there are a lot of community relationships that have grown out of this. Because
And a big important day was when Reverend Walker said, "I'm rolling up my sleeve." I said, let's get the newspaper for
Yeah.
that.
Oh,
Let's get your congregants look at what you're doing and have trust in what you're doing.
Right.
Absolutely.
I'll tell you another effect this stuff had on me is I went to see my primary physician after I got where I could go see him, and my A1C had jumped up to 8.
Diabetes.
Diabetes.
And
Yeah, he's
And
diabetic.
again, so your diet, were you known to be
Ozempic.
were you known to be diabetic before?
Do what?
Were you known to be a diabetic patient before that?
I had diabetic in my family, but I was never diabetic. But now
Right.
it's got down to 5. He got it back down to 5 right now.
Well, good for you, and praise to your family doctor for being so excellent. The fact that you have diabetes at all just is another challenge to your immune system, which unfortunately is a very large part of our community.
And those on chemotherapy.
Absolutely. Everybody knows, for example, a couple months ago, General Colin Powell died, and he had a cancer that compromised his immune system. And even though he was boosted, had his 3 shots, he still passed away from COVID because he could not mount an immune response.